I'm going to talk about who Direction Home is other than these seminars. So Direction Home, you can see on screen, I'm going to step behind here so I can see what the heck I'm saying. We provide long-term care choices for people to live independently in the place they want to call home. And that's really what matters, is the independent part, right? So most of us want to age in our homes, but we don't want to just live, we want to really thrive, right? And that's our goal of what we do here at Direction Home, is to allow people to really thrive in the place they want to call home. Area agencies on aging were started in 1965 with the Older Americans Act, and there are more than 600 area agencies on aging throughout the nation. We're a nationwide network. There are 12 in Ohio, and we at Direction Home cover Portage, Summit, Stark, and Wayne counties. But you can see, if you know of somebody who might need a service that we provide, but they don't live in one of our 4 counties, there's going to be an area agency on aging somewhere in the nation that can help. So please let us know. We can put you in contact with that local area agency on aging. But who is Direction Home in particular? We are a privately held nonprofit who is part of both a state and nationwide network, and you saw that nationwide network of area agencies on aging. We, of course, have our executive staff who have backgrounds in business, law, social work, and policy. We have more than 250 staff who are primarily licensed social workers and registered nurses. And then, of course, we have our board of directors, both for our agency, and we have a foundation branch as well. We are basically your front door to simplifying long-term care. It's a complex network. We can help demystify it. We can talk to you about what community and government programs might be available to help you, how to get help so you or your loved ones can continue living, again, in the place that you want to call home, and where to learn about program or community options for home-delivered meals, senior housing, transportation, caregiver support, education, and so much more. And who do we help? This is an annual snapshot. You can see we've helped more than 12,000 callers with information and assistance, just generalized information and assistance. More than 11,000 people with Medicare patients to avoid hospital readmission. So you get discharged from the hospital, everything is a little bit confusing. We have people who can help you make sure you are following your healthcare team's advice, directives, so you don't get readmitted. More than 10,000 people assessed in our community, and more than 8,000 members are care managed for home and community-based services on our particular programs, and then more than 2,300 attendees of continuing education classes. So those licensed professionals are nurses, social workers, nursing home administrators who need to maintain their licensures, and people who attend our health and wellness workshops. And I see some of you in the room today. So, okay, great. You're looking through our programs, and in your packet, you will see, I'm going to steal this packet up here. You will see a brochure that is ours. Oh, look, this one doesn't have one. Fabulous. There it is. That's it. Thank you. So we've got some programs listed in there, and I have a screenshot of it here in just a second. I promise I will give this back to you. But where do I begin? You can call our Aging and Disability Resource Center, and every single area agency on aging in the nation has an Aging and Disability Resource Center. You'll see it abbreviated ADRC, and it's the starting point to get connected with our programs and also to find out information and answers to all your age-related questions. If it's not our program, we have a lot of community resources that we can share with you. It is important to know that calling the ADRC is free to everyone all the time. Anyone can call at any age. You don't have to be 65 or older. We take referrals for other people, and there is no obligation. If you talk to us, we don't lock you down. It's like that thing I keep hearing, if you get one of those robocalls, you're not supposed to say yes. Like, am I speaking to blah, 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 and you say yes, and then you're locked in, you've answered yes, and they can use that's not us. Okay, we're not doing that. There is absolutely no obligation with us. What can you call for? To see if you're eligible for one of our programs, and we'll do an initial screening. Alzheimer's, dementia, and wellness information, family caregiver support. We have a fantastic family caregiver program, home and community resources, extra help with Medicare. We're going to chat about that a little bit today, in-home assessments, and then just general information and community resources. So, okay, great. You're looking for help. You've seen some of our programs. What does it look like when I start the process and call, right? So the first step is you'll call our ADRC, our Aging and Disability Resource Center, and talk to one of our trained representatives. And they will do an initial screening with you, find out what your goals are, and just kind of in general your situation, right? And we can talk to you about long-term care options, right? We'll do that light assessment. And then if you choose, we can set up an in-home assessment where one of our nurses, or registered nurses, will come to your home, do a deeper assessment about what your needs are and eligibility for our programs. And then if you're eligible, we'll go ahead and sign you up and walk you through that whole process from start to end. Great. You're enrolled on one of our services. How do I receive them? So once you're enrolled, most of our staff are care managers, social workers, and registered nurses. And that is what we call our home and community-based services department. They help older adults and people with disabilities accomplish everyday tasks like bathing, dressing, preparing a meal, managing money. Our care managers oversee the providers that help you do that directly. And the programs might include Passport, assisted living, care coordination. You can see all of those up there. We also do, at times, qualify for temporary grants that start new services, and we'll run those services as long as that grant is available to us. So here's where you'll look at this program. In this program, you will see this chart. It lists out our programs and who is eligible for them. So as you are looking through that, thank you for letting me borrow that. As you're looking through that, if you see something that offers a service that might be beneficial to you, a neighbor, or loved one, please give us a call, talk to us further about it. Don't self-select out if you see it and say, well, I checked that box and that one, but not that one, so I can't get that service. Call our ADRC, do the assessment with our representatives. Everything is so individual, they might see a way to get you access to that program, and if not, they're going to connect you with another community resource. So who actually performs the services? We have all these programs. You saw some of the things, dressing, bathing, feeding, transportation. Who actually does the services? So we contract with more than 250 providers, including home health agencies, both for-profit and nonprofit, home medical equipment providers, adult day providers, home delivered meal, assisted living facilities, and more. So we contract with these providers, and then we also have a whole department that makes sure they are dotting all their I's and crossing their T's, make sure that they are giving you the best service possible. So that's actually who performs the services, and then our care managers, because it can be several different providers. So you don't have to call the transportation service and you don't have to call the in-home nurse. Our care managers are the ones who coordinate that for you. Well, what about elder rights? We do have an elder rights department where our long-term care ombudsmen are, and they are basically our complaint investigation and resolution department. They go into long-term care facilities, so assisted livings, nursing facilities, group homes, and ensure that residents' rights are being upheld. Everybody who lives in a long-term care facility has residents' rights. You can wake up when you want to. If you don't want to go down to the dining hall to eat, you don't have to. We're making sure that those residents' rights are upheld. They also offer information on Medicare benefits. Francine is part of this department. Medicare rules and options, and they also can share long-term care provider selection assistance. So you can sit down with somebody and say, these are the things I'm looking for in a long-term care facility, if that's where you're choosing to be. Say, I want to make sure I can take my dog, and go through what you want and kind of help you select a facility that would match what you need. Family caregivers support. So family caregivers are those unpaid individuals maybe helping an aging parent or a child, adult child who is disabled. We do it because we love them, but it can also be stressful, right? So we give support to our family caregivers as well. Fantastic program. We have free support groups, both in person and virtually. They are led by Teresa Niewiadomski. She is a licensed social worker and a certified caregiving consultant. And we also have free information and assistance, one-on-one consultations with our family caregivers, referrals, and education and planning. So if anybody is interested in that, or you know somebody, please, please, please get a hold of Teresa. We've got a team of people that are just phenomenal for our family caregivers. We also have opportunities for health and wellness. We just are building a program called Aging is an Art Form, where we are connecting older adults with all forms of art. Because as we age, we don't just curl up in a corner and become irrelevant, right? We're still very vibrant and fun and creative, right? Right? Yeah, we are. So we are, one, getting our own creative juices flowing, and then showing the community how powerful we still are, right? We do continuing education. We touched on this very quickly. So both for our staff and professionals in the community, they can attend our continuing education sessions and maintain their licensure. And then free evidence-based health and wellness programming, free. I want that to sink in, free to attend. We have 2 falls prevention programs, Tai Chi for arthritis and fall prevention, and bingo size. Some people in here have done Tai Chi with me, and it's fun, right? Where's my Tai Chi people? Raise the hands high. There's more than one. There we go. There we go. Tai Chi is fun. We hold them here periodically. We can take them out to other locations in the community if you've got the space. Let me know, and I am happy to try and work in our classes for you, either Tai Chi or bingo size. And we're always looking for people to help expand those programs as well. If you know of a space that's willing to host us, or you would be interested in becoming a leader, talk to me. Talk to me. There's some benefits. I'm looking at my existing participants, wink, wink. You know what it's like. We do have a foundation, and we are restructuring how it works a bit, and we have identified 3 main focus areas. So we are really working on access to community services, improving those, and making sure everyone has access to those services. Innovation, funding that fosters partnerships, entrepreneurship, and returns on investment while creating innovative solutions that optimize aging. And finally, investing back in our agency so we can better serve you, our population. So that, in a nutshell, is what we do. At the bottom of this slide is our contact information. That 877-770-5558 goes directly to that ADRC. And even though it's an 877 number, it's in this building. Okay, when I sit at my desk, I can look over my left shoulder and see that department. If you want to reach our front desk, that 800-421-7277 is what'll get you there. And then our website is dhad.org. And the last thing I'm going to do, so I mentioned to our Zoom participants, if you want the materials that our in-person people have here today, or in-person people, if you want to share them with somebody else, this is where you go to our website. So you'll go to that dhad.org. This is our homepage, what you'll see when you get there. And if you put your cursor on the resources and education, you'll see that menu pop up, and you'll go down to the Medicare education option. Okay. From there, that's what you'll see when you get to our Medicare education page. And as you scroll down, the first thing you'll see is about these seminars, brief little summary of what we talk about and some bullet points there. And then you'll see our schedule of events for this year. You are in seminar number 2, so welcome. Scroll down below that schedule. By the way, we still have open seats for next Wednesday too, so let people know. So if you missed a seminar and would still like the materials, here you go. Here's where they all are. That top one there is a recorded session of this seminar. It'll be posted to the website. You'll see the slides, Medicare FAQs, all the Advantage Plan comparison charts for the counties that we cover, and on down with all kinds of resources. So that's how you get there to find in-person people, the packets that are right in front of you, Zoom participants, if you haven't gotten yours yet, that's where you can get them. So all kinds of information there. So now I will turn it over to Francine. I don't see her in the room. I can tap dance till she gets here. Anybody wants? Woo! Who's doing it? Oh, Bridget's back there cheering me on. All right, so Francine will come in now. Here she is. Round of applause for Francine Chuchanis. I'm gonna let me turn on the mic for you. So this one's on, and if the batteries die, there's that as a spare.
Okay. Thank you, Lori.
Mhm.
Okay. Good morning, everyone. Did you enjoy your coffee and whatever you decided to eat? Good. All right. Well, we'll get on with it since we just gave you a commercial for our agency. Now we're going to talk to you about Medicare. Oh, it's not. Now can you hear me? No? I'll hold it. See if that works better. No. Now? Yes. Okay. All right. So first we'll talk about Medicare enrollment. How many people here are already enrolled in Medicare? Okay, most of you are, but there's a few here that are not. So Medicare is national health insurance for people over the age of 65. It is not income-based like Medicaid. People often ask me, what's the difference between Medicare and Medicaid? Well, the difference is Medicare is for people over the age of 65, people who are disabled through the Social Security Administration for 24 months, and people with end-stage renal disease, Lou Gehrig's disease, permanent kidney failure, and persons eligible for railroad retirement. Medicaid, on the other hand, is based on income and resources. So resources meaning how much money do you have? Medicare enrollment, you can enroll the first 3 months before you turn age 65. If you do that, your eligibility will begin the first day of the month you turn 65. So if your birthday is December 7th, if you enroll 3 months before December 7th, your Medicare benefits will start December 1. If you enroll during the month of your 65th birthday, up to 3 months after, coverage will begin the month following your enrollment. If you are getting a Social Security check before you turn 65, you will automatically receive a Medicare card in the mail because they know that you're turning 65 and they know who you are and where you live. And then if you miss your initial enrollment, you can enroll between January 1st and March 31st. And depending on which month you enroll, your benefits will begin the month following your enrollment. There are some special enrollment periods. So people who are impacted by emergencies or disasters will have a special enrollment period. If you move into or leave a nursing home, you are also granted a special enrollment period. And if your health plan or employer, if you lose the coverage through them, you also have a special enrollment period. And if you're on Medicaid and you lose your Medicaid, you have a special enrollment period. So we do these seminars now because it is now what we call open enrollment. So this is a time when you should be checking your coverage. If you are in a Medicare Advantage plan, you should have received what's called an annual notice of change by now, which tells you how the plan you're enrolled will change in 2026. You can make any changes to your coverage between October 15th and December 7th. And this includes both people on Medicare and Medicaid, because some people can actually have both. So when we talk about Medicare, I know there's a lot of alphabet soup, but basically there are only 2 forms of Medicare coverage. One is traditional Medicare, And you know you're on traditional Medicare if when you go to the doctor, you give them your red, white, and blue card. You may have supplemental insurance that goes with that, but I will talk about that later. The second kind of coverage through Medicare is through a Medicare Advantage plan. And you know you're on a Medicare Advantage plan if you use a card that says the name of your Medicare Advantage plan, whether it be SumaCare, Primetime, Anthem, any of those. Under traditional Medicare or original Medicare, each of these choices has advantages and disadvantages. So when we're talking about traditional Medicare, the advantage that most people see with that is that you can use any provider that accepts Medicare in the entire United States. And generally, for most people, there is no prior authorization system. However, this is going to change in 2026. There is a pilot program, and I'll mention this again later, but Ohio is one of the states that will be in that program. With original Medicare, you have out-of-pocket costs, and to cover those costs, you can add what we call supplemental insurance or Medigap. Medicare Advantage plans are not supplemental insurance. It's just another form of Medicare. And as I mentioned, there's no geographic restrictions with traditional Medicare. However, there are no extra benefits. Traditional Medicare typically doesn't cover hearing, vision, dental, and there are no out-of-pocket limits to how much you pay for your care each year. If you don't have creditable prescription coverage through a retirement plan or the VA, you have to add a separate drug plan. And then the supplemental coverage or Medigap plans that you get can increase in cost with age and other factors, and they can become expensive. So the second form of Medicare coverage are Medicare Advantage plans. Advantages, they have a lot of extra benefits. They have low monthly premiums, many of them do, but you have to have both parts A and B of Medicare. There are also out-of-pocket limits, which I'll be pointing out later. Most of them include drug coverage, so you don't have to have a separate drug plan. And they all have to cover everything that traditional Medicare covers, but there may be geographic restrictions. So when I look at Medicare Advantage plans each year, I have to look at what's available in each county that we cover. So we cover Summit, Portage, Stark, and Wayne. So I do those charts for all 4 counties because there could be slight differences. Also, you have to jump through some hoops with Medicare Advantage plans. So they can require numerous prior authorizations. There also may be provider restrictions. So you have to use their doctors and their hospitals, or if you're permitted to go out of network, you may pay more. And you cannot add any supplemental insurance to cover your copays under Medicare Advantage. So when we talk about Medicare Part A, and remember, Medicare Advantage has to cover everything that regular Medicare covers. Medicare Part A covers blood, home health care, hospice care, inpatient hospital care, and skilled nursing home care. So with hospital coverage, the reason the date says 2025 is that the actual numbers for 2026 have not been released yet. Typically, they're released around the first week in November. I don't know for sure if they will be released if the government remains shut down. But I have investigated projections for you. So this year, if you had regular Medicare, you had a deductible of $1,676 that you had to meet for the first 60 days. That is projected to increase to $1,716 in 2026. After day 60, again, it's rare that we're in the hospital for that long, but after day 60 this year, you would have had a daily rate of $419 per day. That is projected to increase to $429 per day. And then if you are so severely ill that you're still in the hospital after days 90, you can use what's called your lifetime reserve days, but you can only use them once. And for those days, it lasts up to day 150. And this year, you would had to pay $838 per day. And that is projected to increase to $858 per day. And typically, these numbers do change a little bit and go up every year. So plan for that in the future. So Part A also covers skilled care in a nursing home. What do I mean by that? Skilled care is physical therapy, occupational therapy, speech therapy, or if you need to be daily monitored by an RN because you're so medically complex. Nursing home care is just for custodial care because you need help eating or you need help dressing or you need help walking. None of that is covered. So only skilled care is covered. And under traditional Medicare, you have to have a 3-day hospital stay, which does not include the day of discharge. And it does not include if you're on observation status. After that, you have coverage in full for your stay. And usually a lot of people go in for rehab. So you have full coverage for 20 days. If you're there longer than 20 days, you will pay a coinsurance amount of $204 a day this year, projected to increase to $214.50 next year. The benefit can last for 100 days, but I have to tell you that it's very, very difficult to stay skilled for 100 days. Only those who are very medically complex can actually keep this benefit for those 100 days. Now, a new benefit can begin if a person does not receive care in a hospital or a skilled nursing facility for 60 days. So then it all starts over. Again, you have to have another 3-day hospital stay under traditional Medicare. Medicare Advantage plans typically do not have that 3-day hospital stay. If you are receiving skilled therapy in a facility, you have the right to appeal any denial of service or reduction in service. You always have the right to appeal unless a service is not covered by Medicare. So if any service is covered by Medicare and you're denied that service or the service is reduced, you can appeal. If you're in for a rehab, the main questions for the appeal that you need to answer are, can care be safe and effective without the involvement of skilled professionals? So what does that mean? That doesn't mean that an aide comes in and does what we call restorative therapy. What it means is it's safe for you to have care if it's not done by a physical therapist, occupational therapist, a speech therapist, or an RN. And then are skilled services needed to maintain or slow your decline? That one is often difficult to win an appeal by, but there is a case called Jimmo versus Sebelius, and this Sebelius person was the head of Center for Medicare and Medicaid Services years ago. And that case, a judge ruled that, yes, that could be counted for skilled care. So you'd have to show through your medical records that this is the situation. Medicare Part A also covers hospice care. So hospice is comfort care. It's not curative treatment. It includes coverage for pain, symptoms, and relief, for drugs and durable medical equipment. Sometimes an aide or homemaker service is available if the person is at home. It also covers spiritual and grief counseling. It does not cover room and board in a skilled nursing facility. So somebody can be in the skilled nursing facility under hospice, but they still have to pay their room and board unless they're on Medicaid. But if they're in the home, and let's say the family is taking care of them and they're under hospice, the family can get what's called respite care, where the person will go into the nursing home for a short time just to give the family a break, or maybe the family wants to go on vacation. And then there's a 5% copay for those services. Home health care is also covered. This can include aid services. By the word intermittent means you can't have it forever. It's short term. You must be homebound, but by homebound, it doesn't mean that you can't ever leave your home. Homebound means that it requires you to a taxing effort to leave your home. So if you can show that, you can still get home health care. You have to have a face-to-face visit with your doctor, who has to certify the need for the care. The doctor has to develop a plan of care for you. And this can also include social services if you're in need of those. So then we have Part B as in boy, and that's your medical insurance. And that covers doctor visits, it covers preventive care and vaccines, durable medical equipment, which is wheelchairs, canes, walkers, things of that sort, ambulance services, and some drugs that usually these are the drugs that you have to have administered in the doctor's office. So here again, we don't have the numbers for 2026 yet. Everybody pays a premium for Medicare Part B. This year, the premium was $185 per month. It is projected to go up to $206.50 per month. Also, there is a yearly deductible. So let's say you go to the doctor in January. Your Medicare Part B, you have to hit that deductible first before Part B kicks in. And that amount this year was $257, projected to be $288 in 2026. Then after you hit that yearly deductible, you pay 20% of the Medicare approved amount, not 20% of what you're being charged. So if the doctor charges $60, Medicare pays him $40, you pay 20% of $40, not $60. In Ohio, the rest goes away because we have a no balance billing law. So watch your statements closely. Medicare Part B is the part that covers observation status for in hospital stays. So that 20% can add up pretty quickly. Medicare Part B and D are also income adjusted. So if you're fortunate enough to have incomes above the amounts listed on the slide, you're unfortunate because you'll have to pay more for your Part B and your Part D. There's what's called a hold harmless provision. And what this is that it prevents Social Security payments from decreasing if the Medicare Part B premium is more than the cost of living adjustment in your Social Security check. This number has been released. And in 2026, people receiving Social Security will receive a 2.8% increase. So we expect that to be enough to cover any increase in the Part B premium, but if it's not, you're held harmless. The average Social Security increase for that 2.8% for most people is going to be around $54. For others, it will be more. To benefit from the hold harmless provision, if it goes into effect, you must have received Social Security and paid premiums in November and December of the previous year. Your premium also needs to be deducted from your Social Security check. And some people do not have it deducted from their Social Security check, so you have to have that. Now, there are those individuals who can delay enrolling in Part B. So if you, and I get this question a lot, I get callers calling me. So let's say husband is still working, has insurance that is creditable under Medicare. He's got good insurance with his company. So his wife turns 65, She can enroll in Part A if she wants. You don't have to, but she doesn't have to enroll in Part B because her spouse has insurance through his company. The kicker is you have to tell Social Security that you want to delay your Part B. So when I turned 65, I have insurance through Direction Home. It's good insurance. It's better than Medicare. So I delayed my Part B premium. If you lose your employer coverage, and let's say somebody chooses to be under COBRA, usually you can get COBRA for 12 months, although it's very expensive. But you only have 8 months to enroll in Part B. And if you don't enroll in Part B when you're supposed to enroll in Part B, you will pay a lifetime penalty of 10% of the premium for each month you were eligible and did not enroll. So you want to make sure that you enroll in Part B on time. So as we saw, there are many out-of-pocket expenses with traditional Medicare. So many people opt to purchase supplemental or Medigap insurance. Medigap insurance, you have a chart that looks like, if I can find it, this. Got orange color on it. These are supplemental or Medigap insurance plans. And what they are is that they are private insurance that covers the out-of-pocket costs of traditional Medicare only. So that can only be paired with traditional Medicare. You must be 65 and have both parts A and B. Premiums vary for these by company. Now, Plan A, all of these plans are the same across the country. So the coverage is the same. But depending on who you choose to buy your Medigap plan from, you could pay maybe $87 a month for Plan A at one company. And for that same coverage for Plan A, you might be charged $120 a month from another company. So it's kind of like car insurance, where you have to check and see what the premiums are. Premiums can vary. Plans C and F are only available to those who enrolled in Medicare before January 1st, 2020. So even if you just enrolled in Medicare Part A, you can still be eligible for plans C and F. They have very high coverage. They can also be expensive. And then the best time to get your Medigap or supplemental coverage is the first 6 months you have both Parts A and Part B. So at that time, you have what's called a guaranteed issuance. That means that they can't ask you about any pre-existing conditions. They can't charge you more. They can't underwrite you if you have pre-existing conditions. However, there is no coverage for prescriptions, dental, vision, long-term care, although some of the companies, remember I said the companies vary, some of the companies do add silver sneakers to those Medigap plans. So you kind of have to check around for those. Now, if you're outside of your guaranteed issuance, they can ask you questions about your health, and you can be underwritten, meaning that you can be charged more. The way these plans work is the premiums vary by these 3 things. Some plans have what's called community rating, and that means that all policyholders are charged the same premium without regard to their age. And if the company decides to raise their premiums, it's raised for everybody, regardless of age. Then there's issue age, and that's when these companies base their premiums on the age at the time of purchase, but cannot raise premiums based on age later. They can, however, base premiums on other factors. And then there's plans that are called attained age. And I think most of the plans are these types of plans. And that means that they can vary based on age and that your premiums can increase based on age. And they can also base premiums on other factors. There are, for people of lower incomes and means, there are programs called the Medicare savings programs. You have a handout in your packet regarding these programs. They are based on income and assets. There are several programs. The first one, the QMB, pays for both Part A and Part B premiums for people and all their copays and deductibles. The second one and third one only pays for the Part B premium. The fourth one will pay for the Part A premiums for people under 65 with disabilities who maybe haven't worked long enough to not have a premium for Part A. Because most of us don't have a premium for Part A. And I should have mentioned that. There's no premium. And that's because if you worked full-time for 10 years, you have already paid into the system. Or your spouse, if your spouse has worked full-time for 10 years. So unless you have creditable coverage for prescriptions through the VA or other creditable coverage, like through a current employer or a past employer, you need to purchase Part D. Now, as I mentioned, Part D is included with most Medicare Advantage plans, although there are a few that does not include the Part D. But if you're on traditional Medicare and you don't have coverage through VA or other creditable insurance, you've got to purchase what's called a standalone plan. And those are these with the green heading. These are standalone prescription drug plans. And as you'll see, we've listed the premiums, the annual deductible, and the star ratings for you there. Again, if you don't enroll in Part D when you were first eligible, you will pay a lifetime penalty of 1% of the national base premium for each month you did not enroll. In 2026, the national base premium is $28.99. So people say, well, I don't take any drugs. Well, yeah, you don't expect to get in a car wreck either, but you have insurance. You don't expect your house to burn down and you still have insurance. You can't get Part D in the middle of the year. And I have had people call me, I didn't get Part D, I'm sick, and it's July. They can't get Part D. They have to wait till open enrollment, so now during this time period, but their coverage won't begin till January 1st. So it's not something that people should wait on. Every year, there's what's called a standard benefit for Part D. So in 2026, these numbers have been released. So in 2026, the initial deductible, now this means companies can have a deductible less than these amounts, but they can't have a deductible more than these amounts. The initial deductible for 2026 went up to $615, which is a year, which is up from $590 this year. That was kind of a big jump, and a lot of plans took advantage of that. But then there's an initial coverage limit. So that old donut hole is gone. So you're going to pay 25% of the costs of prescriptions until you hit $2,100. So if you take a lot of prescriptions and you hit that amount, you then fall within catastrophic coverage and you will have no more out-of-pocket costs. So that's a positive change. But there again, even that number went up $100 this year. You can now spread your costs for your prescriptions over 12 months, and you can be billed by your plan monthly. The $35 cap on insulin, and it could be less, but it can't be more than $35, and no deductible that was put into effect last year stayed in effect for this upcoming year. When I looked at the standalone plans, these are those plans that with the green heading that go with traditional Medicare if you don't have other coverage. There were some reductions in premiums, but then the deductible went up to that $615 amount. There was also a significant reduction in the number of plans overall. I think last year there were 22, there are 10. When Medicare Part D first started, there were, I think I read there were 60 some plans available. Now there's 10. And only 3 of those plans serve people who qualify for what we call extra help. And that again is based on income and resources. So when you're looking at a Part D plan, you want to make sure your prescriptions are covered, and you want to make sure you know how much you're going to pay for those prescriptions. And that can vary significantly from plan to plan. You also want to look at any restrictions on the prescriptions you take. Do you require prior authorization? Are there quantity limits? And is there step therapy? Step therapy is usually on those high cost new drugs where they want you to try all the cheaper drugs first. But if you've already tried all those cheaper drugs and they didn't work well for you, you can ask your physician to appeal that decision. All your physician has to do is let them know that you've tried those lower cost drugs and they weren't effective for you. And then you want to make sure that you know what their in-network pharmacies are. So you can go to any pharmacy and say, hey, do you take this prescription drug plan? And they'll probably take them all. And they say, yeah, we take them all. But the question is, are you in network with my plan? Because you're going to pay less for your prescriptions if you go to an in-network pharmacy. And then you want to look at the star ratings. And I was a little disappointed in the star ratings this year, but I would definitely not pick a plan below 3.0, but don't tell anybody I said that. And then you want to look at the star ratings, as I said. Star ratings, what they're based on is member complaints. How many complaints did the plan get? The number of people who left the plan the previous year. Did they provide accurate drug pricing to their members? Their ease of filling prescriptions? And what were the changes to the plan? I mentioned the low income subsidy or extra help. That has been expanded to 150% of the poverty level. And for those individuals, they will pay no premiums and no deductibles if they choose a plan with a premium in Ohio of $39.30. They will also pay reduced copays for both their generic drugs and their brand name drugs. People can apply for this program through the Social Security Administration, or they can call Direction Home. So you need to check your prescription prices yearly because they change yearly. Your prescriptions might be covered by the plan, but you might be paying more. So when I take 2 prescriptions, when I put them in, I find significant differences from plan to plan. So you need to take that into account. To check those prices, you can go to the Medicare website and you'll say find plans, click on that, and it'll walk you through how to do it. You'll have to enter your prescriptions, the dosages, and how many you take per day. You can call Medicare, which is probably not the easiest way to go. Or you can call the Ohio Senior Health Insurance Information Program, or OSHIP. And you have their number there. I know these days, we gotta be careful. Okay, so we talked about traditional Medicare or regular Medicare. Now we're gonna talk about the second form of coverage. Again, these are not supplemental plans. This is just another form of coverage under Medicare. And many people ask me, this was a question the other day, from a couple people. Well, can they underwrite me? No, because it's Medicare. These are just private plans who contract with Medicare. So yeah, they have to take you if you're eligible for Medicare. But you must have both A and B. Many include drug coverage. If they don't, you have to pick one of those standalone drug plans. If you look at these big charts that we made, the long one, colorful one, these are Medicare Advantage plans. And again, there's different chart for Summit, Wayne, Stark, and Portage counties. So if you look at the chart will show you the overall star rating. So star ratings are from 1 to 5. We don't have any plans that are 5 stars, but we do have several 4 and 4.5 star plans. Monthly premiums are listed. If it shows a health deductible that does not include drugs, that's just medical deductible. Most include drug coverage, but the ones that don't are in the back and in red. So these are the ones that don't include drug coverage. So if you picked one of those, you'd have to get a separate drug plan. You'll see that we listed the drug deductibles. So they vary anywhere from like 150 up to the total amount of $615, which is allowed. Most of them have no copays for primary care doctors. But if you're a person that sees a lot of specialists, you need to look at the cost of the specialist because that can be anywhere from $25 to $45 per visit. Some allow doctor choice, some do not. So where it says HMO, that's Health Maintenance Organization. You must use their doctors in their hospitals to be covered. Where it says HMO POS, that's Health Maintenance Organization Point of Service. That means your primary care physician can send you to an out-of-network doctor. However, you might have to pay more. And then where it says PPO, Preferred Provider Organization, typically they will allow you to go out of network, but you may have to pay more. And you'll see that your maximum out-of-pocket limit is higher if you go out of network. So if you're a person who uses a lot of or needs a lot of medical care, you need to look at those out-of-pocket maximums closely because you may want to choose a plan with a lower out-of-pocket maximum. As I mentioned earlier, most of these plans do not require a 3-day hospital stay for rehab in a skilled facility. There are those out-of-pocket maximums, which you don't have if you choose traditional Medicare, even with a supplement. So Medicare Advantage plans, again, are not supplemental. They're just another form of Medicare. You can't have a supplement. You cannot have a supplement on top of a Medicare Advantage plan. And if you join a Medicare Advantage plan and you decide you want to go back to Medicare or join another Medicare Advantage plan, you do have one last opportunity to do that between January 1st and March 31st of next year. Medicare Advantage plans have those wonderful extra benefits: fitness benefits, telehealth, cash cards, dental, hearing, vision. Those extra benefits are not available in traditional Medicare. When you're selecting a plan, focus on the services you use most. So if you know you're going into the hospital for a knee replacement, and you might have to stay at the hospital for a couple days, you want to look at what the hospital charges are under the Medicare Advantage plan. And usually they're listed, the benefits are listed as days 1 through 5, you pay X amount. Days 6 through 10, you pay X amount. So it's different than traditional Medicare. You want to look at their formulary to make sure your prescriptions are covered. And you want to make sure that your doctors that you go to are part of the plan. So are they in network or are they out of network? You also want to pay attention to those star ratings. And when we talk about plan reputation, I do not want you to ask your neighbor or your friends. Don't listen to them. Oh, I've got such and such a plan. You need to get that plan too. It's wonderful. Maybe you don't. It's very individualized what plan you choose. You can call your doctor's office and you can ask them not only which Medicare Advantage plans are you going to accept next year, but also which Medicare Advantage plans are easiest to work with, because they know what plans deny all the time, what plans have more prior authorizations. So they'll be able to give you that information. And it's much more reliable than your friends or neighbors, believe me. The star ratings for Medicare Advantage plans are based on how many members get their preventative checkups. So things like mammograms, vaccinations, how many member complaints were received, how many appeals were done. And again, if you're denied, you should always appeal because many times the appeal will go through. How many members chose to leave the plan? And did the plan provide important information to their members? Because many times they do not. Locally, in all, our premiums in our 4 counties remained relatively stable, and the number of choices we have is much more stable than in other parts of the country. Some parts of the country lost a lot of Medicare Advantage plans. We did not in our region. There were, however, significant increases in out-of-pocket limits in some plans and significant increases in that drug deductible. And sometimes extra benefits may be reduced, but you should have already been informed if they were by letter. If not, call your plan. So in addition to these choices to make things more complicated, there are also what we call some special needs plans. And these are plans specifically for people that have a specific diagnosis like any kind of chronic condition, heart disease, diabetes. Also, there are plans that cover people in nursing homes. Some have premiums. Some have medical and drug deductibles. Benefits vary, and they, again, if you're interested in any of these, you should compare them to each other. And then I might mention that next year, anybody who is in MyCare Ohio currently will be forced to enroll in what we call a DSNP. So it's a dual special needs plan. By dual, again, I mean people that have both Medicare and Medicaid. That particular program for people that have both Medicare and Medicaid will begin in counties where there's already MyCare. So all of our counties already have MyCare. So people that have both are in MyCare Ohio unless they have third-party insurance. State will then expand the program statewide slowly, first in April, then in August. The plans under MyCare Ohio will be different in our region than what they are right now. So right now, people have to choose either CareSource or United for Medicaid. They can still choose any plan they want for Medicare, but they have to choose one of those two for Medicaid. They can also choose to have that plan for their Medicare also. And if they do that, there's some extra benefits. Next year, United Healthcare will not be part of MyCare Ohio. So anyone in MyCare United will have to switch to either Anthem, CareSource, or Molina. And the reason I left out Buckeye is because Buckeye is not permitted to enroll new members next year. Letters to current people on MyCare should have already been sent out. And if there's questions, they can be addressed to the Medicaid hotline. We had a couple people the other day who are on MyCare. We do have, I do have a plan comparison chart that I can provide to those individuals afterwards, and I copied some for you. So again, these are the places you can go to compare your coverage. Again, there's OSHIP and the Medicare website. If you're not comfortable with the computer, ask a family member to go on the Medicare website with you, or have somebody younger who's easily can use these. Switching plans. All right, remember, this is the time of year that you can switch your Medicare Advantage plan, or you can go back to traditional Medicare, or you can go from traditional Medicare to Medicare Advantage. Now is the time. If you're in a Medicare Advantage plan, you can drop it and go back to regular Medicare, or you can go to another Medicare Advantage plan between January and March. But that enrollment only applies to people who chose Medicare Advantage. It does not apply to people with traditional Medicare. And then those individuals who have both Medicare and Medicaid can opt out monthly, which really isn't a good idea, but you can. I want to talk to you about some marketing guidelines. Brokers are not permitted to provide misleading or high pressure tactics. They are prohibited from unsolicited contact by phone, text, or email, although I know you're all getting calls. Now, you're allowed to get calls from the company that you're in, but you really shouldn't be getting calls from other people. If you are, they're not supposed to do that, and maybe they're, on the level, but it could be a scam. Hang up. No door-to-door solicitation is permitted. And then the brokers have to inform you of all plans they represent. So not all brokers represent all plans. They may, or not all brokers sell all the Medigap plans. So they should tell you which ones they are with. And then if you change your coverage, they're supposed to explain to you what the change, how it affects your current coverage, your doctors, your pharmacies, because you want to go in network, your medications, and other costs. Again, because I'm a long-term care ombudsman and have served as a Medicare ombudsman now for 24 years, I want you to know you have the right to appeal any payment denials for covered services under Medicare. The appeal process is a little bit different if you're in a Medicare Advantage plan or you're in traditional Medicare. And if you need assistance with that, you can always call us. Prescription appeals, however, should go through your doctor. Really, only your doctor should do those. And then please be aware that prior authorizations are now being monitored. If you feel that you're being denied through the prior authorization system over and over again, you also have the right to appeal that. And then there are appeal steps now for observation status. Only if your status was changed after you were discharged from the hospital. So let's say you were in the hospital and they told you you were admitted. You were not on observation status. Then you go home and you get a letter and a bill that tells you, oh, you're on observation status. You can appeal that decision. In other news, and some of this is not so great, I apologize for that. Supplemental benefits offered by Medicare Advantage plans now must issue a letter in the middle of the year to you telling you what extra benefits you did not use. That's a good thing, because many people, what the research has found, knew that there were extra benefits, but they'd never used them. So now the plans have to tell you in the middle of the year, hey, you never used this benefit, and you might want to. So that's a good thing. If you have a Medicare.gov account, they now require an email address. So put your email address in there. Social Security is not going to issue paper checks anymore, and that began on the 30th of September of this year. And then I briefly mentioned a new demonstration that will require prior authorization for some services if you're on traditional Medicare. And this affects 6 states, including Ohio. So there's going to be 14 treatments that will require pre-approval. Some of these will include nerve stimulators, epidural steroid injections, spinal fusions, knee arthroscopy, and skin substitutes. The reason for this is apparently someone feels they're wasteful. Having had knee arthroscopy, I don't know how wasteful that was. It saved me from having to have knee surgery, so whatever. There also is a 5-year plan to cover the weight loss drugs. This would allow state Medicaid and Medicare Advantage plans to cover these drugs voluntarily. The hurdle, it's caught up because of the price of these drugs in the United States. And here you'll see the difference between costs in the US, costs in Japan, for instance. Medicare now limits coverage to those who have diabetes or heart disease. But this proposal is not final yet, so keep a watch on that. Now for the Medicare Trustees Report. So the Medicare Trustees Report for this year looked at last year in the numbers, and they found that the Hospital Insurance Trust Fund will become insolvent in 2033. That could cause payments to be cut to providers, or it could be a reduction in benefits. Part B and D remain financed adequately, but that's because we're paying into the system. What happens with Part A, that hospital insurance trust fund, is it's dependent on the number of workers in the United States paying into the system. So as all of us baby boomers hit Medicare, there aren't enough younger people paying into the system, and that's one of the reasons for the shortfall, not the only reason. Expenditures in 2024 for Medicare were about $1.1 billion. It represented 3.9% of our gross national product and 14% of the federal budget. Possible solutions to shortfalls with Medicare. These are things that are being tossed around right now. To increase Social Security taxes. So right now, if you're working and you have a paycheck, you're going to see a deduction for Medicare. And that's capped at, I think, like $160-some thousand a year. So once you hit that amount, you don't pay in anymore. So some people are saying, well, we should take that cap off and increase Social Security taxes for everybody and then take away the cap. Also cutting provider payments. That's not such a good idea because you still want to have a lot of doctors that take Medicare. And so that's, I don't know about that one, but that is being floated around. And then the last one is to cut Medicare benefits. So what can we all do? Stay aware of what is happening in DC with this. Read about Medicare from reliable sources. Ask your representatives what they believe is the solution. I mean, you can list those and say, which ones do you think is the solution? And then vote. It's as simple as that. And this goes for young people too, because there's a fear that there won't be Medicare as we know it or Social Security in the future. So these are things that we all need to pay close attention to. And, just based on your beliefs, what you think should happen, put those into action at the polls. And with that, I'm happy to take some questions.
Okay, I have got the microphone and ready to bring it to you. Anybody in the room with questions, raise your hand high. Here we go. Real close.
Hi, I'm Dan, and I just moved here from California. I left 34 years ago, so I'm turning 65 in December.
Okay.
So I'm all kind of new to the Medicare nightmare, as I may say, and a little confused because I don't even know kind of where to start, which plan to pick kind of side by side and how to go about doing that. So someone like me who doesn't have doctors, doesn't have really anybody here, should I use a broker? Should
You
I
can.
reach out to you guys to kind of just help
Here's
with
what I
that?
suggest. You're young, you know how to use a computer. It's okay to use a broker, but go on the computer yourself first. Okay, click on Find Plans, do an analysis, and do it for both traditional Medicare with Medigap and Medicare Advantage plans. And then that can kind of tell you where you might want to go. Look at those advantages and disadvantages I listed, and then see what you're more comfortable with. And then yes, call a broker. There's nothing wrong with calling a broker, and they may be able to assist you.
Okay. And when I bring the mic to you, if you would hold it pretty close to your mouth too, your face too.
Hi, Francine.
Hello.
My nephew is helping his parents find a Part D plan, and he wants to know on the website, are the predicted drug costs actually accurate, or might there be hidden costs and fees, et cetera?
The drug costs on the Medicare website for now are accurate. Those can change though through the year. The anything hidden to look at are those restrictions. So look carefully. Are there prior authorizations? Is there step therapy? Those types of things.
Oh, okay, up here. Sorry, I'm looking all around and didn't see you.
I just wanted a word of caution. Although there's a guaranteed issuance and the no underwriting when you the
Right.
first time you choose
Right.
your supplemental insurance, that doesn't carry over to if you want to make a change.
That's
You
correct.
can be declined. I was trying to
That's
switch.
correct.
And the insurance that I was looking at to switch to declined me because of previous history.
And that is especially true if you're trying to go down in coverage. They will ask you, but they can ask you about your health. So, and switching those Medigap plans can be a problem.
Over here. Okay, I will go to you first and then you.
Francine, you mentioned the hold harmless provision. Is that in effect now?
Yes,
Okay.
yes. We don't know the increase in the premium. It's the increase in the Social Security check is supposed to cover it though. So I think everybody will be paying that increased amount.
And on the Medicare site, can you compare prices for the Medigap?
No.
Where can you go to do that? Just each
I would
individual?
call OSHIP. They may have information on prices. I know they have a list of companies that sell Medigap plans. And then I know people that will just like eeny, meeny, miny, mo and pick some and just sit and just call them and say, hey, what are you going to charge for plan F or whatever you choose?
And then here.
Hello. Will
Hello.
they charge, well, I'm sorry, switching Medicare Advantage plans in January through March? If you're going from one Advantage plan to the other, do they have to do underwriting for that?
No, because it's Medicare. Underwriting only applies to that private insurance. Medigap is private.
Okay.
Okay, it's not Medicare. It just goes with Medicare.
Okay, I'll go back here and then back up to Mike.
I currently have United Healthcare AARP, but I don't see it on that list. It's not on here.
It's
United Healthcare AARP.
AARP is first. It's the first plans listed.
United Health. I see United Health. What's it?
Oh, wait, right here, AARP. United Healthcare. Which one is the one you have?
But I don't.
AARP is United Healthcare.
Okay. Okay, but it says Advantage. I don't have an Advantage plan.
Do you have a supplemental plan?
Yes.
Okay, they sell supplemental plans too. Those are Medicare Advantage plans.
Okay.
So
That's why I'm
companies like
confused.
Anthem, United, a lot of those companies, they also sell supplemental plans. So they're not going to be on that Medicare Advantage
Okay, it would
chart.
be this year then? No, that's which one would be?
Yeah, we don't have comparisons for the supplementals, right?
No, there
Yeah.
are too many of them.
Okay. And Mike, you had a question?
And we can't guarantee price because we don't know if they're going to charge you more based on your health.
Is this accurate? Besides silver sneakers, there's an equivalent silver and fit.
Yeah, it's a lot of them have a fitness benefit that is not called silver sneakers, but
Right.
I think it's equivalent.
Yeah, the YMCA said it is. We have a friend who's 100% on Medicaid. Did you say there, did I hear you right? Did you say there's 2 Medicaid programs in Ohio?
Does your friend have Medicare too?
No.
Okay, then they're not in my care. They're just Medicaid, fee for
Okay.
service.
Is there a choice in Medicaid or
There is, and they can call the Medicaid hotline to find out.
would a Medicare broker that sells
No,
that
no. Medicaid hotline is where you go for Medicaid coverage.
Medicaid hotline?
Uh-huh.
And do you know what that number is?
I don't know it off the top of my head.
Okay, Medicaid hotline. And,
I'll look it up for you after we're done here.
okay, and there are at least 3 nationwide bill sharing faith-based prayerful cooperatives. Thank you.
Whoa, hands popped up. Okay. I'll go to you in the orange and then I saw people in the center, so I'll come back here.
On the Advantage Plans handout, the Medigap premium types, can that premium change from what's listed on the handout?
That handout is only for Medicare Advantage plans. That is not Medigap insurance.
Gotcha.
Yeah.
Thank you.
And the hand, okay, we'll go here first and then move towards the front.
Oh, yeah. My dad's been wondering if he switches, like we're on Humana right now,
Uh-huh.
and if he switches, that concern about prior problems that you have or whatever, if he switches, is there a concern that he won't be covered on the Advantage plans?
No, because Advantage plans are Medicare.
Okay.
They're not anything else.
Okay.
They are private companies that contract with Medicare, but they are Medicare. They
Oh.
have to take people.
Okay. So they can't deny us if we say we're going to
Nope.
switch and okay.
Yep.
Just wanted to make sure. Thanks.
Okay, then more you and then you.
Okay, I'm currently employed and I have my insurance through my employer, but I'm planning to retire like within the next 5 months. Should I sign up for my benefits through Medicare now? Or can I wait until like if I retire in March, can I wait until then?
It depends on a lot of factors. One of those factors being, do you have what's called creditable insurance that is primary to Medicare? If your employer has more than 20 employees, typically that insurance is creditable under Medicare. So you ask your company, number one, that question. Do I have credible insurance for my medical expenses and my prescriptions under Medicare? If you do, you can wait to sign up for Medicare. Now, the other factor you want to look at is what is your coverage like? So I'll give you an example. My sister has coverage through her company, but she has what's called a high deductible plan. And so she has her deductible per year is $6,000 a year. So I told her to go ahead and sign up for Part A, delay her Part B, because as she goes into the hospital, she'll pay less under Medicare. So you have to look at the costs.
Okay.
And then there was one in the row in front.
If a person, I make $1,300 a month. When you said about Medicaid can help a person, but they go with your assets too. What do
Yes.
they mean by assets?
Stocks, bonds, cash in the bank,
Okay, that you're going
real
to be,
estate.
okay, your home, your car,
No.
your bank.
Well, no. And there's a difference between full Medicaid and getting help through the Medicare savings programs. So I would recommend that you look at, you have in your handout, in your packet, there's a brochure or pamphlet for Medicare savings plans. Look at those income limits. And you can call Job and Family Services or call us, and we'll see if you qualify for any extra help, either with your prescriptions or your Part B premium.
Even though I might have a bank account?
It depends on how much is in that bank account. So those limits are listed in your handout. Okay? You're welcome.
Back here. Walking around this room is why I felt okay eating a muffin.
I have a friend who still works part-time every day pretty much, and she could not attend this presentation. And if she's uncomfortable using the computer for a lot of things, and she's thinking about changing plans, can she call Direction Home and get guidance from them?
No, we are referring to OSHIP.
Okay, thank you.
We can take a couple more questions. We've got another group coming in right after this, so we're going to have to flip the room soon, but we can take 2 more questions.
Okay, I have health benefits now, but I'm going to be 65. Which do I have to have a secondary to the Advantage Care to get the silver sneakers? Or is that the secondary? Is that through my secondary?
If you're not on those are silver sneakers goes with Medicare.
Oh, so when I sign up for Medicare, it automatically get the silver sneakers.
Yeah.
Okay. Okay. Then I should.
Anybody have one last question? Anything online? No? Anybody have one last question?
Thank
All
you
right.
all for attending. I hope
Yeah, thank you.
it was helpful to you. Feel free, you can call me if you have additional questions. And for those, if anybody's on MyCare Ohio, out at the registration desk, I do have comparisons of plans.